who are joining us this afternoon. Dr. Suresh Kumar is the lead consultant pediatric critical care at the Yashoda Hospital in Hyderabad. Dr. Sharwari Dua is from the Internal Department Medicine at the Madhukar Rainbow Children Hospital. Dr. Kumar, I'm going to come to you first. Today we are seeing students between the age group of 15 to 18 get inoculated. It is a big milestone in India's fight against COVID-19. But this is happening at a time when we are in the middle of the third wave. The third wave has already started, and a part of this wave is being driven by Omicron, a variant that does not respect vaccines. So for those people who are saying inoculation to ho raha hai, but what's the point? Look at Omicron. It is even infecting people who are double vaccinated, some who even have boosters. What will you say to them, especially when it comes to students?
Let me start off with two things. One, vaccine is the only thing which is available right now. And two, that doesn't mean we need to get rid of our mask or not need to follow COVID appropriate behavior. Let us be very clear. Vaccine is one thing which will definitely protect us irrespective of the variant. It might to an extent reduce the infectivity, but to more extent it will reduce the morbidity and mortality. What we have seen even during the second wave, there were quite a few who were immunized but got COVID. But looking at the severity, it was definitely much lower. And during the second wave, we saw nearly 15% of the cases were children. The entire population who were affected, 15% of them were children between 11 and 20 years. So if we are vaccinating majority, that is 15 to 18 years, we will be covering at least half of that. It is definitely going to be a positive impact. Do not be under the impression that it will not cover Omicron. We have seen that during the swine flu that the variant changes every 6 months, but the vaccine which is given will definitely reduce the morbidity and mortality. And I was listening to some of the students who were getting ready for the party after the vaccination. Let us be very clear, COVID appropriate behavior still needs to be followed despite the vaccination.
Yeah, a vaccine shot doesn't mean it is time to party and that you can start partying. It simply means you have one layer of protection. There is another layer of protection to go as well. And given how fast Omicron is spreading and given that it's piercing the vaccine cover as well, really not the time to party, really not the time to be in a mall or to be in a large group, especially indoors. Dr. Dua, I'm coming to you here. There are, 40% of India's... All right, we'll try and go across to Dr. Dua in just a bit. But Dr. Kumar, if you could answer this question to us. I want to ask, this is just actually going back to the basics. We've learned about the importance of masks in the last 2 years. For those who are saying that community spread of Omicron has already started, there is nothing you can do to stop it, that everyone will eventually get it, why do we believe that masks will still work in a situation like this, doctor?
So it's a wrong impression that once the community spread begins, we can't do anything. Why, in first place, why has it happened? That's because some of us might not have followed the COVID appropriate behavior. That must have led for the rapid spread. Having said that, with the COVID appropriate behavior, despite the community spread, we can still get it under control. And if we can vaccinate 80% of the population, definitely that can be to an extent controlled. What we have seen for polio or many other diseases, that's what has happened. If we can cover 80% of the population, we can definitely arrest the spread and reduce the morbidity. So the idea is, if we are vaccinating children tolerate the vaccination much better than adults. To an extent, they are all tuned to taking vaccines in last few years. They would have remembered. But most of us adults do not remember what our last shot was. So children tolerate better, and India has a better infrastructure to cover large-scale population when it comes to pediatrics. Indian Academy of Pediatrics has already extended the support to Government of India to take part and help in taking the vaccination program forward.
Okay, Dr. Dua, you're back with us. I want to ask you a quick question on behalf of parents whose children are below the age of 15. Look, fact is that, Covaxin was tested on kids 2 years and above. The government of India has given it emergency use authorization for children 12 years and above. Now, if you look at the data that has come to us from South Africa to begin with, and then from the United States of America, it seems it's the younger children, 5 and below, where we are seeing an increased hospitalization because of COVID, whether it's Omicron or Delta. So I just want to understand, shouldn't this group have been the one that should have been inoculated first? What is the logic of inoculating 15 and above before, inoculating the ones between 5 and 10 or 2 and 10?
Okay, that's a very valid question. Actually, a lot of people, when this age group was decided and when they begin to start the drive, the age group that was fixed was on the basis of the trend that we saw in the second wave, especially in India, because we saw that most of the children that got affected, in fact, not just got infected, but required hospitalization or intensive care were the ones with comorbidities, especially obesity was one of them. Obesity was a big challenge when we were tackling children, especially the early teenage children. And that is why I think the decision of choosing this age group was more evidence-based in respect to the last wave that we had experienced, which was devastating. However, globally, there are different studies and there are different groups now that are being involved, and we are saying that 9 to 12 years also is there are studies which say that 9 to 12 years is a good age where you can get vaccinated, and also there are no complications, vaccination related complications that are being seen in children. However, anyone who's below 5 years, we still consider that there are other vaccination programs that carry out. There is a lot of innate immunity from the childhood that protects the children from a severe COVID-19 infection. And hence, I think it is better that we focus on the early adulthood or teenage groups, because they are more prone to complications like lung-related complications, or especially children who have diabetes and obesity. They were found to have serious critical infections in the second wave, and I think that is why this decision was put. And with the trend now, we'll also come to know if younger children are also susceptible, especially to Omicron, the new variant, about which we do not know too much. But we're hoping that if there are mild cases only, then we can still spare children who are below 5 years old, just because they have a better immunity.
Okay, Dr. Dua, we'll leave it there for the moment.